Hello, my name is Steve Hendrix, and I'm the president at m.Care. Welcome to the next episode of the m.Care podcast series. With me again today is Mike Braham. Mike is the general manager and senior vice president at Trapollo. Mike, welcome back to the show.
Thank you. Thanks for having me.
So when we finished our last episode, we were talking about the state of the healthcare industry specific to telehealth and virtual care. We've talked a lot about where the industry's come over the last couple of years, but specifically in the last 6 to 9 months. And so what we didn't have a chance to do was talk a little bit about your vision for Trapollo and where you all fit into where we're headed as an industry, what Trapollo brings to the table, because I think it's a great story of how you all have evolved and where you all are headed as we move forward. So Mike, again, welcome, and I'll let you kind of share with us the Trapollo story.
Thank you very much. Well, I think the Trapollo story is also a Cox Communications and Trapollo story. I'm kind of the blend. I'm that intersection. Many years ago, when I first really got involved with telehealth, it was while leading one of the largest regions in Cox Communications, in specifically Cox Business, and we were working with some of the largest healthcare providers on the East Coast at that time. And we were changing a model where we were really focusing on how could we provide voice and data and video that was so reliable that it could be used in a hospital setting. It could be used in a clinic. It could be used in a provider's setting. And we did that successfully. Cox has now grown that to where I first started, we were just dealing with a couple of hospitals. Cox now is providing those voice and data and video capabilities to well over 260 hospitals across the United States, and about 40,000 of their, we call child accounts. Like if it's underneath of a healthcare organization, then what would be the clinics and the radiology units and things like that would be using that. Trapollo is and was essentially a small entrepreneurial company based out of Fairfax, Virginia. Trapollo as a company was purchased by Cox about 5 years ago at this point. And it was really bought because Cox wanted to accelerate more into getting involved, not just with the network side, but also on the delivery of working on telehealth and on remote patient monitoring. And so now for the last 2.5 years that I've come on, we're building upon the success that Trapollo already brought. And that was a certain level of expertise in remote patient monitoring, in dealing with the facilitation of how do you actually get the equipment in and out of someone's home. How do you be sure that it works and connects appropriately with care platforms like m.Care? And so now where Cox is going forward is we're really stepping into a kind of creating a new category we're called connected care or connected health. And so in the connected health environment, what we see is that so often we have, the infrastructure to enable for healthcare to occur, in so much as that we're supporting the business side. And so much of telehealth, it's still prescribed in the business, but it's delivered in the home. And I think that's the big aha that we want everyone to understand, and where Trapollo differs than what is just the limitations from where Cox is in certain geographic territories that are legally where they are allowed to provide their services. Trapollo works across the United States. So we're not bound by any geographies. And in fact, we're all wireless. So what we're really able to do is to provide this both and. So where there is the landline, the broadband and other kind of services, build upon that. But the flexibility that so often, the patient doesn't, let's say, reside in a location that serves just by Cox or any other of the MSOs that are out there. They might be in that urban or rural underserved communities. Any patient that can reach a cell tower at this point with their device can have healthcare. And that's where we're so excited working with LST and with the m.Care platform, is to provide this capability of now how do we continue to take data points and pull it all together and now provide solutions for all of these populations that are needing this care going forward.
Yeah, I think that's a great point, Mike. So when Mike and I met a couple of years ago, one of the things I valued very much out of Trapollo was their ability to not only provide services, but they provided consulting. They had a vision for where we were going as an industry, from remote patient monitoring right into virtual care. And so there was this convergence, not just of our m.Care platform, but of the Trapollo strategy and vision for bringing it all together and delivering an end-to-end solution. So Mike, maybe you can talk a little bit about that convergence and where you all are going from a technology standpoint and what that vision and strategy looks like going forward.
Sure. Well, we're trying to, again, build upon the connected health platform. And the platform really is where we're going to try to bring the best of the software solutions that Trapollo has today and actually team up better with the m.Care and creating a converged platform. And in that, we're really going to be further supporting the care of these specific populations. And most likely it's, in America, the congestive heart failure and the COPD and diabetes are the big three. Working with m.Care and really where is a heart and passion of one of the things that I bring from my past life, it is not just taking the physical health, but it's also looking at the behavioral health and pulling those things together to where we're truly now going to deal with a total individual. And where we can also engage the caregiver / family member oftentimes. Now you're really looking at holistically, how am I going to deal with the physical, the emotional, the spiritual part of that person as they're trying to navigate through their healthcare journey. So I think it really provides us this really neat opportunity in trying to recognize that you just don't treat the physical side of somebody, but when you can treat their behavioral side, the things that are motivating or demotivating them, and finding a way to better encourage them overall through their healthcare challenges and or again, even on their healthcare journey, if it's positive, it's like we're not just looking at the sick side, but we're looking at how can we also deal with, happy and exciting things like the birth of new children, where the ability to use the platform for both episodic care or even on primary care, but then it now allows us to go from the beginning to the end of someone's healthcare challenges.
Yeah, thank you, Mike, very much. Certainly, the landscape has changed dramatically since you and I first met, and I'm really excited about the journey together and where we're headed, both of our organizations, but the industry in general. So again, thank you for taking the time out to visit with us today. Very much appreciated. To everybody else on the audience, again, thank you for your time. If you have any questions for us as I close again every episode, I encourage you to send your questions in to steveh@m.care relative to what's going on in the healthcare industry, and we can certainly schedule future podcasts to cover those particular topics. Again, stay well, stay healthy. Thanks for your time.